Thank you for giving this opportunity. Okay, so as part of Dell Technologies, we have been working with Government of India from last 5+ years and earlier with Telangana government and Karnataka government in building a non-communicable disease platform. We started with the primary healthcare platform with the idea of how currently the public health sector, which is there, where you have ASHA workers, you have health workers on the field, and then you have primary health centers in various like villages and areas. So how do you bring in technology and digitize a lot of work they do? So with that, I will just like to first start with a brief about how Dell Technologies is associated with it. So I'm part of, just a second. Yeah. So Dell Technologies, I'm part of ESG group, Environment, Social and Governance group within Dell Technologies, and we have we have a lot of moonshot goals we have set for ourselves, and one of them is how do we use our technology and people skill to impact and improve lives at scale, and we have a target of 1 billion lives to be impacted by 2030. So as part of that, we have done these 3 initiatives. These are in the healthcare space and in the education space, where we are working with UNICEF on a Giga project for school connectivity and a digital medical twin with the Harvard on using genetic data to be able to do a personalized care. So for this conversation, I will focus on digital life care. Which basically, we have been working, it's an open source solution platform we have built for Government of India. We are the lead tech partner for that. There are other ecosystem partners like Tata Trust, who are our field partner who does the trainings on the ground and managing the system. But it's primarily a Government of India initiative launched by Honorable Prime Minister in 2014 under Ayushman Bharat scheme. So currently I will just a little bit talk about NCDs, non-communicable disease current burden. So it aligns with our UN SDG. We have India has set its goal, and there are like these NCDs are especially focusing on hypertension, diabetes, and 3 common cancers, which are oral, breast, and cervical. And these non-communicable diseases are like silent. They are chronic. Like once you have hypertension, you will have to do a follow-up. You have to continuously do a follow-up and medicine adherence. So it's very important to have a way of managing those patients and make sure these people are coming back to the public health or to a healthcare facility. So, but along with that now, there's opportunities also for India as a country for making a lot of like improvements in digital public goods, which includes Aadhaar. CoWIN has now, was how the trend was set. And then now everything like with ABDM, the Ayushman Bharat Digital Health Mission coming into the picture, where you have an unique health ID created for every individual, and a health exchange platform, a consent framework has been laid down. So this provides a opportunity for a lot of like new startups as well, and other companies also to come in and support this digital initiative by Government of India. So as part of that, the NCD program was launched, and now India has set a goal of having like by 2025 achieving 75 million people to be on patients with hypertension and diabetes to be on a standardized care. So so this is a national NCD program which has been running. So as Sir was mentioning about the prevention and the population-based screening we need to do. So that's where this government initiative started in 2018, where it includes population, everyone above age 30 to be screened for hypertension, diabetes, and these 3 common cancers. And a continuum of care has to be achieved. Like in the journey, earlier the focus was on getting people enrolled into the system, getting them screened. Now the focus has shifted in the last 1.5 years to ensuring control rates in hypertension and diabetes, and how we can achieve that through and by making sure we are following the disease protocol laid down by Government of India. So I will just talk a little bit about what are the tools we have created as part of the digital life care platform, which powers the India National NCD portal. As part of that, there are multiple applications. There are ASHA workers on the ground who are, so there's one ASHA worker per 1,000 population. So they have a job of doing enrollment and doing a risk assessment. So they do a very basic risk assessment. We call it like community-based based assessment checklist. And based on that, the next step with the bubble 2, which you see here, is for the ANMs and the health workers who are on the field. So what they do is they do the screening of for these 5 diseases, and there's a decision support system inbuilt into this application. This application is being used on the field. They do go door to door. So there's offline capability has to be there, and they should be able to connect and share data whenever connectivity comes. So once a person has been screened, and based on the protocol, it says this person should be referred. So those people have to go to the nearest primary health center, where you find the first, the qualified doctor sitting there, and they uses a decision support system as a recommendation, and then the final decision is done by the doctor. For hypertension and diabetes are usually managed at that level, but any cancer-related or any specialized cases for hypertension and diabetes, they get referred to the more specialist hospitals, which are CSC and district hospitals. And so along with that, there are admin portal who manages this entire system, user creation, and alignment with the ABDM now, the FRR, the HFR, the hospital facility registry, the user registries, and then the program officials, which basically have a view of this data coming from various sources, and to be able to make decision on where they need to focus on. So they have access to data starting from the India level. They can drill down to state, district, and go to the village and look at these key indicators, like how many people are screened, how many are under treatment, and then control rates, follow-ups, and the performance of the facilities as well. So going forward, these are the basic features which are there as part of the system. A longitudinal health record, which basically makes the base, which is backed by ABHA ID, which is a national health ID, which has been launched. Then there are offline applications, there's screening disease and e-referral and treatment management protocols. And the important part is like work plans. So work plans for health workers. Like as a health worker, I'm looking at a population of 5,000, and I need to know which one to follow. So right now, so before this program, a lot of these decisions were paper-based. They had to look at a list and follow up, and now this data is readily available to make to be able to figure out which patient they need to visit today. If I'm going to a village X, I can look at these 10 people needs to do a follow-up, and if they don't come up, there's a due list, there's an overdue list, and the doctors and the health workers can reach out to the person to make sure they are following up this adherence protocols. So, and these are like some of the tools for program managers for ensuring continuum of care across various facilities. They are traveling from a primary health center to a secondary, to a district hospital, then coming back once the treatment is going on. The medicine adherence happens. The medicines are distributed by these by the health workers directly, instead of them again going to the primary health center or a facility which is far away, because that becomes like a lot of issues for especially people in rural areas, because they have to they are mostly on daily wages. So that's why the adherence goes down. And then health workers have monthly follow-up list and the laws to follow-ups and all. So this is the current numbers. So obviously in India, every problem is a large problem, is a scale problem. So these are the current numbers we are able to achieve using this platform. So the NCD, national NCD portal is being used across 33 states, and then there are a few states who are using their own system, and they are sharing aggregate data, and to the those states are sharing aggregate data. So the entire dashboard is available at a India level, at a health minister level, at a joint secretary level, to be able to monitor, and then obviously at the state levels. So like 160 million screenings have been done. But now the focus is, as I said, has shifted towards making sure the control rate is what we are focusing on. So that's where we are moving towards. And 225K users, like health workers, doctors, have been trained on this system across the countries. These are all government health workers, government doctors who are using this system. And more recently, as part of G20, we also got an opportunity to present it. And this has been is being provided as a digital public good for other countries to consume as a digital public good from India. So yeah, so with that, I mean, these are obviously, it's not only Dell, there are a lot of other ecosystem, the ministry ecosystem along with it, like AIMS, WHO, NHSRC, which is a public health arm for ministry, and then other other like Tata Trust, who is involved in training and management of this program. Some information about digital life care. I think this PPT will be shared, so you can look at it. And just I'm leaving with some screenshots of the health worker application, the ASHA workers, and then the dashboard, how it's being managed across the system. So thanks with that.